So hi everyone. So today this is a session where we are going to only done surgery. That is a cesarean section. So the cesarean section has become very common. Sometimes there are indications and sometimes requests for a cesarean section. So now the important point here is there are very many questions ask us that how to take care of a cesarean section scar, and there we have when patients are recovering from a cesarean section scar. Here, I thought I'll share a few points, few very common questions which are asked, and a few questions. Now, generally, when you are recovering after a cesarean section, we generally, after a cesarean section, we allow your diet just the very next day. We allow you to go to your washroom yourself. You can get up, have a small. As far as your scar line is concerned, we generally advise that from your bed or you lie down, you don't have to get up straight or from the bed or lie as a pressure on your abdomen. Generally, it is advisable that you turn to one side and elbows and get up, and the same way turn to your side and lie down. That will produce the scar and give you. Additionally, help that generally you will all those who have undergone a cesarean section would relate to it, that whenever you try to get up, you try to put your hand on your abdomen on the scar side. You feel, you'll give it support. Additionally, that support can be given by an abdominal belt also. So you can tie a belt. So whenever you're getting up or you're lying down, then belt will give you that support and you will feel less of pain. So I have a question. How can I control itchiness around the cesarean section? So your scar per se and the antiseptic solutions which we use for cleaning your abdomen before the cesarean, and the dressing which we put, the antiseptic dressings which we put, give a lot of dry skin, and sometimes they can give irritation and itchiness around the scar. So the most common thing and most commonly what can be done to reduce that discomfort is application of a moisturizer. The best is coconut oil. So just take a little bit of coconut oil. The amount is just that it moisturizes the skin. You don't have to make the skin oily. So just massage the skin around wherever you're feeling itchy with coconut oil, and that should make you feel better. So generally you are sent home on around this. Generally the dressing which you put initially after the cesarean is little tough dressing, that is a dynaplast, which is to give a lot of pressure on the area of the scar. But once you are discharged, then we try to put a waterproof dressing. That's a lighter dressing, and that's a waterproof dressing which is put over the scar so that you can take a shower easily. But additionally, what I advise my patients is that you get cling film in the market. Like you have aluminum foil. Similarly, there's a kitchen cling film. So once you are discharged, you can wrap that cling film around additionally over the dressing and take a shower so that you can feel fresh and better, and the scar the dressing is also not wet, and you can carry it on for another week till the time you're visiting us again. As far as the wound infection is concerned, once a dressing is done, locally per se, you will not be able to do anything much to control the infection. What you can do from your side is eat healthy. Take the prescribed medications by the doctor in time. Avoid other infections. Any infection like cold, cough, urine infection, any infection in the body can lead to a scar site infection also. So eat healthy, have lots of liquids. Sometimes there are traditions where females are not allowed to have water after delivery. That makes you prone for a urinary tract infection and other infections also. So have lots of liquids, have healthy eating, and have medicines prescribed by your doctor. So that will help you largely prevention from any infection of the cesarean scar site. Now there's another question that has been asked, that somebody had a cesarean delivery 4 months back and the stitch feels like pulling and aches a bit. Is it normal? So you have to understand, once your cesarean scar heals, the skin heals very well in time. Like 1 week later, you go back to the doctor and the skin is all joined. But the nerves are like electric wires. They take time. Now you have to understand that once they are trying to build a bond with each other, the nerves per se. So they give this tingling sensation, this pulling sensation. We say pins and needle pricking sensation. So that is how nerves heal. So this kind of stretching is healing of the nerves, and it's absolutely normal. An average time of healing of nerves, that means when you stop having this feeling and you stop noticing, is around 5 to 6 months. So around 5 to 6 months later, this stretchiness will stop and you will not be having any problem. So somebody also had an infection around the cesarean stitch that appears as a red rash and small bumps. And how can that be managed with home care? Now you have to understand that this rash can be because of the dressing also. The antiseptic dressing which is put, some people are allergic to it. People are allergic to sutures, to sometimes antiseptic solutions, and to the dressings per se. So once the dressing is removed and you feel like that, so you have to put something soothing. So it is just a rash. You can put something soothing like a calamine lotion over this, and if your doctor prescribes some steroid ointment, so 2 to 3 days of application should soothen out that allergy. And if it is very severe, don't try to manage it at home. Go and see your doctor, and maybe some oral medications are also needed. So will wearing an abdominal belt irritate my cesarean scar and cause infection? So I've already told you that a belt is sometimes very helpful. Now, as far as this belt part is concerned, I want to clarify that people feel that the lax abdomen which they have after cesarean, if you wear a belt, then you will, your tummies are going to become flatter after wearing a belt. So losing abdominal fat after cesarean section and coming back into shape is partly natural and partly how early you resume your fitness schedule. So here it is very important to conceptually understand that the abdominal belt has no role in bringing you back into shape. It just helps supporting the scar, and whenever you get up or lie down from the bed, it gives less pain. So abdominal belt per se will not irritate, rather help your scar and help in supporting it and cause less pain. And of course, you have a dressing over your scar till the time it heals, and after that, a belt should not be a cause of any kind of infection. So, what I would like all my listeners to understand is that every procedure has a healing process and time, which can be different for different individuals. Sometimes we compare our healing with our friends, our cousins, our colleagues who have had similar kind of surgeries. So your body is your own. So taking care of a cesarean scar by having healthy diet, having a healthy fitness regime, having lots of water, taking the medicines prescribed in time, visiting your doctor for checking of the stitch line after 1 week, whether it has healed well, supporting it by an abdominal belt, and using a coconut oil or some nice lotion to avoid stitching, scratching or itching should do the trick. And the feeling that you haven't had a cesarean, an absolute healing where the feeling is absolutely gone, the feeling of stretching, numbness. Sometimes, the skin feels so sensitive that even the shirt which you are wearing you might feel that you're feeling it more than usual. So all these feelings will settle down in 5 to 6 months. That's an average healing time for a cesarean section scar. Okay. Thank you, everyone. Hoping to see you soon.